welcome. Today we continue to look at high blood pressure and some lifestyle practices that can help you to prevent the disease in the first place and its complications. The goal today is to look at how you can prevent complications of high blood pressure. You don't want to miss this. Stay tuned. Welcome back. A few months ago, I sat down with a few of my guests who have high blood pressure and ophthalmologist, Dr. Shivaram, who explains the connection between uncontrolled high blood pressure and eye disease. Let's take a look.
As in most organ systems in the body, hypertension tends to wreak its havoc slowly and over a long period of time. So whereby somebody might have high blood pressure for a short period of time, they might not have any signs or symptoms in their eyes. Over a long period of time with uncontrolled high blood pressure, depending on the duration and how high the pressure is, there can be problems that can develop in the eye. Many of these problems start off as problems that are not symptomatic to the patient, and therefore they don't complain about them, and they don't tend to be noticed even by providers who see them. But over time, as the changes in the eye occur, it can lead to as severe consequences as blindness.
As you already know by now, uncontrolled high blood pressure can lead to eye disease. Next, Dr. Shivaram explains some of the specific changes that can occur in the eye when the blood pressure is uncontrolled. Let's listen.
The retina is the back portion of the eye. If you think of the eye analogous to a camera with a lens and film, the retina would be basically the film in the camera, and that's where the image is placed, and that's where the image goes from the retina to the brain so that we can actually perceive what we're seeing. And so it's a very important portion of the whole visual process. The hypertension tends not to affect other parts of the eye, and since the retina is in the back of the eye, just as the film in a camera is in the back of a camera, you wouldn't notice that these changes are occurring without looking for them. Now this is actually a normal retina, and this is the optic nerve, which takes the fibers of vision to the brain for interpretation, and the retina is this orange area around it, which is filled with little cells that are able to detect light and in conjunction can check patterns and colors so that we can perceive that as objects in vision. And in order for the retina to work, because it requires a lot of energy, it requires blood vessels and oxygen, which are provided through an artery that goes through the optic nerve into the peripheral retina and provides oxygen. The beginning changes of hypertension occur with basically narrowing of the arteries, which are the vessels that take blood from the optic nerve and into the retina. And you'll see narrowing if you look at a retina, either by your primary care doctor looking with something called a direct ophthalmoscope, or if you go see an ophthalmologist, they'll actually put drops in your eye to dilate your eyes and use a larger lens to be able to look in the entire periphery of the retina. You'll notice that there will be changes in the caliber of the vessels, and that'll be the first change. The second change that tends to occur is something called arteriovenous nicking, where the arteries take blood out from the optic nerve and the veins bring them back to the body, and they tend to cross over each other. In the areas where there's hardening of the arterioles, you will see nicking, where the arteries bypass or go over the veins, and those areas become prominent. Over time, the next things that are noticed are little hemorrhages. So the blood doesn't end up just staying within the blood vessels, it actually leaks out. And sometimes that can mean what we call a flame hemorrhage, where we see a large hemorrhage that looks just like a flame, just a red flame. Leakage can also come by as something called exudates or hard exudates, where you get portions of the blood but not the entire blood itself, and you'll see that as basically a yellowish pattern, a star-like pattern on the retina. And those are the two main things that you would tend to see. as the hypertension gets worse. Even during those stages, you might not notice any vision changes.
Let's take a quick break. When we return, the patients had the chance to ask Dr. Shivaram some questions about eye disease and uncontrolled high blood pressure. So stay tuned for his response.
When we return,
we abbreviate central serous retinopathy of CSR. It tends not to be associated so much with high blood pressure as stress.
Okay.
And so the connection is not necessarily with blood pressure, but stress can lead to high blood pressure.
then later,
And when you appreciate the amount of work that a heart does and the amount of blood vessels, your heart beats somewhere between 5 to 7 liters a minute.
Do you think what we eat has any relationship with developing high blood pressure?
Yes, it does, like a lot of salt, a lot of spicy foods, and that has a lot to do with high blood pressure, can cause it.
They say that, high blood pressure has to do with how much salt you eat and all that stuff. And I think, it's true, but I guess just recently we're talking about in class that, maybe it's not so much the salt that we eat, but it's more about the kind of genetics that you have. And so, you need to be important. You need to keep in mind that everybody's different. And for most of the public, most of the people, salt plays a big role. And so, we like to put lots of salt in our food, but, it obviously raises our blood pressure. And so I guess that's one way. Too much salt is a bad thing, supposedly. For most people, it's bad for us, and it's going to raise our blood pressure.
Welcome back. If you are just joining us, today we are talking about some complications that can happen in the eye when the blood pressure is uncontrolled.
Yeah, about 20 years ago, actually, I was in a crash. I call it a crash, the stock market crash of 1987. And I lost a considerable amount of monies and with the high stress living. And coupled with that situation, I experienced or suffered what they diagnosed as central serous chorioretinopathy, if I'm pronouncing it anywhere close. So my vision was temporarily lost through big black blotches I saw in my eye.
Could you explain that process to us?
Well, central serous retinopathy would occur in the center of the vision, which is called the macula, and that's where the highest degree of detail is. And in general, what he had, we abbreviate central serous retinopathy of CSR. It tends not to be associated so much with high blood pressure as stress.
Okay.
And so the connection is not necessarily with blood pressure, but stress can lead to high blood pressure. You'll see swelling of the retina, which can lead to significant vision loss. Thankfully, most of the time it tends to go away, either by itself or with laser treatment. But the more serious forms, when you see hypertension get worse, to the point where maybe the systolic pressure is over 250 and the diastolic is over 150, these are patients who probably have other symptoms besides visual symptoms. They will actually get hemorrhages that will cause blindness. And there's different types of hemorrhage, either a venous hemorrhage, where you just get blood in all of the areas of the retina, and it can actually extend forward into a portion of the eye called the vitreous. Or you can get swelling of this optic nerve, which is called papilledema, which can lead to vision loss because the fibers, which are very delicate and are in a very constricted space, if they swell, they can die, and that can also lead to blindness. So there's just a spectrum of disease that needs to be taken into account with hypertension. The good news is that the way to treat it is not to do any treatments on the eye. It's basically to bring down the blood pressure.
As a result of blood pressure, possibly diabetes, cataracts.
Okay.
Worse on my right side. They say the cataract is not quite ripe enough, and I've had the cataract for about 9 years.
Okay.
And so they are leaving it up to me, but how would you explain what that means?
Yeah. Well, in general, chronic diseases tend to run together. So,
right,
in terms of hypertension tends to run with other diseases. It's not. It's very common that you would see it with diabetes. Diabetics do tend to have a higher risk of developing cataracts and other eye problems. So it just goes to show that you need to look at the entire spectrum, not just hypertension, but what other diseases go with hypertension, and how they might affect other parts of the body, specifically the eye.
Let's join Dr. Shivaram as he goes over the recommended eye care for those of you who have high blood pressure.
as opposed to diabetics who are recommended to have an annual dilated fundus exam, which means you should see your ophthalmologist or optometrist once a year to look and see if there are changes with diabetes. With hypertension, there is no absolute recommendation as to annual screening examinations. But if there's a long-standing history of hypertension, and if there's an issue of any vision loss, and it may be something like a cataract that's causing it, we don't know, you would be best to get a referral to an ophthalmologist or an optometrist to be able to get a dilated fundus exam at least once during the course of hypertension. But there are no absolute criteria for screening examinations. Some of the screening is done by the primary care physician in the office using a different instrument called a direct ophthalmoscope, which is somewhat difficult to use and often doesn't yield a very high likelihood of finding something. Thankfully, in most cases of the hypertension, if they're seeing their primary care doctor and they have high blood pressure and it's being controlled, then the risk to the eye is very small, if any.
Absolutely.
Bad hypertension in the eye essentially needs to be treated by controlling the blood pressure.
After the break, we will talk with the cardiologist about the connection between heart attacks, heart failure, and uncontrolled high blood pressure. You don't want to miss this. Stay tuned.
When we return,
And when you appreciate the amount of work that a heart does and the amount of blood vessels, your heart beats somewhere between 5 to 7 liters a minute.
coming up on the next episode.
If one looks at a can of soup, that classically has a tremendous amount of sodium.
Right.
And you might want to use that as a reference for something that has a lot of salt in it.
People want to know, well, normal blood pressure, ideally, you want to keep it below 120/80. So at what point do we start to see kidney failure? Is it blood pressure 140/90, and for how long? Hi, I am Ruth Tanyi, producer of the award-winning TV series called Bad Sugar. Do you have diabetes? Know someone who has diabetes? Unfortunately, all of us do. So listen carefully to what others are saying about the Bad Sugar DVDs.
I have type 2 diabetes, and I've had that for probably 30 years.
I've had diabetes since 1995.
I have watched all of the Bad Sugar series.
I have had diabetes since 1998.
I've watched the TV series Bad Sugar.
I'm a type 1 diabetic, and it's taught me how I can expand my lifestyle. It's taught me spiritually how to monitor my stress.
They clarified everything that the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
Oh, I thought I knew, but I didn't. I had little knowledge, but that series expounded my knowledge.
For me, Bad Sugar have played a major important role in my life to control, to educate, and to teach others about diabetes.
It showed how God operates through us and how we need to connect with God in order to make sure that those sugars operate the way that they're supposed to.
Bad Sugar.
Do you have questions about nutrition and diabetes? What to eat, what to avoid, counting carbohydrates? What about the glycemic index? Or questions about proteins, fibers, fruits, vegetables, fats? Or do you have questions about exercise, stress, spirituality, and diabetes? Or do you want to prevent diabetes complications? The Bad Sugar DVDs will give you the answers you are looking for.
There was things out there that I didn't know, and since I watched Bad Sugar, it's given me a lot of information that will help me further out.
Type 2 diabetes affects a lot of different things in your body, which I never knew about until I saw the episodes 7, 8, and 9.
It's taught me about nutrition, it's taught me spirituality, and it's taught me how to live my life and enjoy myself longer.
I was able to reduce my medicine, and that's due to the fact of the Bad Sugar.
Call 1-866-257-3471. Operators are standing by. Or log on to PreventiveCareWeekly.com and place your order.
Okay, now you know all about the Bad Sugar Diabetes DVDs. Get them for yourself and they will change your life.
To order a DVD, go to our website, PreventiveCareWeekly.com.
Welcome back. Unfortunately, uncontrolled high blood pressure can lead to heart attacks, stroke, and many other complications. Let's listen to what the cardiologist has to say about uncontrolled high blood pressure and heart disease.
Blood pressure elevation, as you know, is basically, and I can use one of my props here, this is thousands of times enlarged over what the normal size artery. But high blood pressure, whatever the cause is, the net effect is a squeezing down of the blood vessels. And that increased resistance means that the heart has to pump against a higher head of pressure. So it's having to work harder to push blood through narrowed blood vessels. And when you appreciate the amount of work that a heart does and the amount of blood vessels, your heart beats somewhere between 5 to 7 liters a minute. That's filling a couple of these plastic containers of soda every minute, and that's each side of the heart. That as the blood vessels cramp down because of the high blood pressure, the heart has to work harder, and working harder makes the muscles, the walls get thicker and stiffer. Now, while exercise such as lifting barbells, the arm is good, it gives you nice looking muscles.
Right.
You don't want the muscles in the heart to build up and get thicker and stronger, because it comes to a break point that the heart will have trouble relaxing. And heart having trouble relaxing is one of the most common forms of congestive heart failure. Eventually, the heart wall will thicken enough that it stops or is unable to contract efficiently and develops weakening. So it'll build up, get stronger, 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 and then it starts getting weaker, 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 and the patient then develops serious congestive heart failure, which is damming back of fluid into the lungs and into the tissues. And the patients experience that as shortness of breath and swelling of the extremities.
There is a lot of confusion about systolic blood pressure, diastolic blood pressure in relation to heart disease. So let's hear what the cardiologist has to say about the difference.
Well, if I can use one of my models here, and this is actually quite a bit enlarged. Your heart isn't really this large. The human heart is actually closer to this size. And it said if an individual would like to know approximately what your normal size would be, if you clenched your fist,
like a fist.
That's about the normal size. But this is blown up so that we can see it enlarged.
Right.
This is opening up. This is the main pumping chamber of the left ventricle. And you can see the thickness of the wall here is about 1 centimeter thick. That's normal. What blood comes in to the left main pumping chamber from the lungs, the heart relaxes a bit, accepts the blood, and then it contracts. And this squeezes, pushes it out the aorta. That happens at a heart rate of around 70 to 80 beats a minute. That means your heart beats anywhere from 100 to 150,000 times a day. So if you think of it from that standpoint, if this pumping chamber is having to push the blood out against a higher resistance because of the constriction of the blood vessels, that's a lot of work.
Right.
That's a lot of extra push-ups, if you please. Systolic blood pressure is basically systole, or the systolic portion of the cardiac cycle, is when the heart contracts.
Right.
That's systolic. And during that time, it contracts, squeezes the blood out the aorta.
Yeah.
Diastole, or the diastolic function, is when the heart's relaxed.
Right.
The heart is relaxed, it's refilling, getting ready to contract again. During that refilling time, the blood pressure in the aorta and all of the blood vessels drops back down to sort of a baseline. It's sort of the quiet period. When we measure blood pressure, we measure both the systolic and the diastolic. Mm-hmm. The systolic is the pressure when your heart is beating. Mm-hmm. The diastolic is the blood pressure that remains in the blood vessels when your heart's at rest.
Right. By now, you may have many questions for the cardiologist. However, my guest had the opportunity to ask him some questions. Let's listen now. Some of his responses may help you as well.
Well, I had an echocardiogram done 2 weeks ago.
Oh.
No, last week, in fact.
Last week?
Last week, last Wednesday.
So, and that was normal?
So far, it was normal.
Well, we usually wait for that. We don't usually use that as a screening unless if we see that someone's had high blood pressure for a long time.
Right.
Or if the patient's having symptoms. Patients having symptoms of shortness of breath with activity, getting chest discomfort with activity, that type of thing, then we start making that measurement with like a cardiac ultrasound. And that's basically where we take and bounce sound waves off of the heart. And it's a technique we borrowed from the Navy. We send ultra high frequency sound that you don't hear. Every time it hits an interface, it sends back a signal. So we can actually measure the thickness of the walls of each of the chambers and the size. We can measure the functional capabilities of the heart to tell us really how bad is your heart condition related to the high blood pressure.
Right.
When I was, a physician changed medications because of the side effects of a previous medication I was taking. So in that interim, I was thinking, or I was feeling my heart pounding, and there was a period of a few months where I was off the medication, and that was probably my doing more so than the physician's, because it was in between my appointments. But probably I would ask, it seems that now, being a little bit older, I am impacted more by the side effects of the necessary medication, which I know it is because it controls my blood pressure, but I'm getting hit with these different side effects more so than I did in years past.
Well, fortunately, we have now quite a number of agents. When I first became a physician, we had a very limited armamentarium. And they were mostly either diuretics or some of the older drugs like reserpine. And virtually all of those made people either sleepy or they had to go to the bathroom a lot and people didn't like them. We have now a broad spectrum of medications. And I suspect from the story you tell me, your doctor probably withdrew a class of drugs we call beta blockers. They block the sympathetic nervous system. And the sympathetic nervous system is the fight or flight portion of the autonomic nervous system. And we commonly block that. That's a very normal kind of a thing to do. When you withdraw that medication, because with time, when you take a medication that has some physiologic effect in your body tries to overcome it.
Right.
And your body doesn't always know when it should just relax and go with the flow and say, well, they're really trying to do something good for me here, so it will try to fight medications. And so what you explain is what we commonly see, and when you withdraw some of the medications, you then may start getting overshoot phenomena.
Right. But that would go away, though, eventually.
Hopefully, yes. And it should go away.
Well,
but
it has already, Doctor.
Oh, good.
With the new medications, I have none of those symptoms and none of the side effects. One of them was coughing. I had a dry cough, and that was continual, and it was.
That's a very common side effect. In fact, for anybody listening, if you're taking any of the classification called the ACE inhibitors, any of the ACE inhibitors may cause cough as a side effect. And the reason for that is your body metabolizes any medications that you put in. One of the byproducts of the ACE inhibitors may go to the lungs and deposit there, and that irritates the lungs. But as you probably noticed, after you're off of it for a while, that goes away.
Goes away.
Yeah.
And we have other medications that we can use in place of
Absolutely.
that. The thing that people need to remember is, first of all, high blood pressure, very common.
Very common.
Probably over 50% of adults over 50 are hypertensive. It is, in fact, the silent killer because you can't internally feel, unless your blood pressure is well over 200, where now it's dangerous, you may have a bleed into your brain.
Stroke.
You may never know that you have high blood pressure until you get it measured by your doctor and it's documented. The other mistake that I see people make is they get the idea that they get a prescription, they take it until the prescription runs out, and they say, I don't think I need to take it anymore. They don't go get it refilled. I feel fine.
My blood pressure is
and
normal.
my blood pressure is normal. I don't need to take the medication anymore.
Right.
And there are very few forms of high blood pressure that are curable.
Yeah.
It's a lifelong process.
Yes, it is.
It is far easier, I can tell you, to avoid the complications of high blood pressure than it is to treat the complications.
Right, and lifestyle practices, exercise, balanced diet, very critical. Let's hear what Dr. Isaiah has to say to prevent heart attacks.
These are actually blown up enlarged blood vessels that are plastic models. And as you can see, if I can get them positioned so I can hold them, this on the far right is the normal.
Okay.
You see the yellow streak on the second one over. That's an early plaque formation. That's the deposit of cholesterol under the inner lining of the artery. It's called the endothelium. And cholesterol starts to build up. It happens virtually everywhere in the body. The key places for us that we really worry about is in the coronary arteries and the arteries in the neck and the brain and the kidney arteries. Those are the ones that could be the most devastating. Then with time, it will continue to build up, and actually you may have a very small narrowing, a narrow opening for blood to go through. Or you may have a plaque like this rupture, and when it ruptures, it bleeds into the plaque and then plugs the artery up. This is the disease process that then in the heart leads to a heart attack. If it happens in the neck or in the brain, leads to a stroke. We can prevent for the most part, but the important thing is people have to be conscientious about remembering that this is a lifelong process. That high blood pressure, if you take the normal to the plugged up, high blood pressure makes you move faster along and it accelerates the disease. So if you don't want to have a heart attack or have a stroke, your best chances of beating the odds is take care of the disease process. Eat right. If you need the medications to lower your blood lipids, do so. It's a lifelong process. And it becomes largely one of self-responsibility.
Absolutely.
There's only so much that I can do when you get the complications. It's really the patient's responsibility. These gentlemen here, they have to take care of themselves and follow the program if they want to avoid coming to me for the complications. What exercise has been shown, if you exercise regularly, that will help to lower your blood pressure.
We talk about diet, exercise, and you see these advertisements where they talk about, well, you eat Cheerios, you eat high fiber foods and things like that. How much of that, what percentage of the plaque can be removed that way?
Well, we know that these high fiber foods are, yes, they are, but they're really only a portion. And it's been estimated you really can get probably a maximum effect of only about 15% reduction in your cholesterol.
And a difference in walking and cardiovascular stress as opposed to being around a house and lifting a few things and doing things that wasn't the same for me.
Absolutely. And one of the best forms of exercise, regular walking. You don't have to be a triathlete.
Absolutely. And
regular walking.
There are no side effects to walking. Thanks for watching us today. This is all the time we have for this show. For questions or comments, visit PreventiveCareWeekly.com and go to the message board and type in your question. And for more information about preventing hypertension, heart attacks, or other diseases, go to the forum and read what others are saying. And remember to also read the future article about preventing hypertension. See you on the next episode. Goodbye.
This program is not intended to be diagnostic or prescriptive. Please consult with your doctor or healthcare provider before adopting any of the lifestyle changes or other measures discussed in this program. We do not recommend any medication changes. Rather, patients should seek medical advice from their doctors or healthcare providers.